Urinary Catheterization. Good day, this is Remedios Cabañero, your student nurse from University of Mindanao. And for today's video, I will be demonstrating urinary catheterization. It is the introduction of urinary catheter through the urethra into the bladder for installation or removal of fluids. So what are the purposes of urinary catheterization? First is to relieve from urinary retention. Second is to obtain sterile urine specimen. Next is that to measure the remaining urine in the bladder after voiding. Next, to control urinary incontinence. To provide access and instilling medication into the bladder. To maintain an empty bladder during surgery. And lastly, to monitor early urine production in seriously ill client. So the materials that we will be needing in this procedure are external lushing tray, bedpan, waterproof underpad, so alternative one because we don't have any underpad, bath blanket, and then a tray containing dry OS, forceps in a disinfectant solution, then working forceps in a sterile bag, alternative also, dry cotton balls, sterile one, sterile gloves, fenestrated drape, 10cc syringe, plaster, gauze, betadine solution, lubricating jelly, triple distilled water in a vial, since alternative one also because what I have only here is sodium chloride, and then urine bag, and then the Foley catheters. Now, let's start the procedure. Check the doctor's order.
Rationale, catheterization is only if with medical order.
Assess whether the client is allergic to betadine or plaster.
Povidone iodine is often used to cleanse the vulva before catheterization. Assemble equipment needed. Organization promote efficient time management.
Identify and explain the procedure to the client. Hi ma'am, I'm buntag. So, pwede mo kumuha na sa ngalan ma'am?
Ensures the right client and elicit cooperation.
Provide good light to locate the meatus clearly. Provide privacy by closing doors and windows, because the client has the right to be protected from exposure.
Replace top sheet with bath blanket. Place waterproof underpad under the client. These protect the bed linen from moisture and getting soiled.
Place client on supine position with feet upward and drape the client.
Good visualization of the meatus is important. Embarrassment, chilliness, and tension interferes with the introduction of the catheter.
Prepare urine receptacle and tubing if an indwelling catheter is to be inserted.
Tubing facilitates in connecting the catheter to the drainage system.
Open the pack and place it near the perineal area. Observe aseptic technique.
Placement of the equipment near the worksite increases efficiency. Sterile technique protects the client and prevents the spread of microorganisms.
Squeeze a small amount of lubricant over the sterile OS placed in a sterile field.
Rationale, organization promotes efficient time management.
Using sterile pickup forceps, get 2 cotton balls with betadine antiseptic solution from the sterile jar and place on the sterile field on top of the several OS.
Wash hands
to prevent the spread of microorganisms.
Put on gloves.
Then do perineal care or flushing. Cleansing the perineal area prevents introduction of bacteria.
And discard gloves.
Put on sterile gloves to avoid cross-contamination. Grasp the upper corner of the fenestrated drape and unfold it.
Place the fenestrated drape aseptically over the perineal area with the penis extending through the opening to provide sterile feel. Holding the penis with non-dominant hand, disinfect the meatus twice using cotton balls with betadine antiseptic solution. Using circular motion stroke, then downward for each cotton ball and discard. The rationale, it cleansed the area and minimized the risk of urinary tract infection by removing surface pathogens. Lubricate 6 to 8 inches of the catheter tip and avoid clogging the lumen. Lubrication facilitates the insertion of the catheter and reduces trauma to the tissues. Hold on penis perpendicular to the body and pull up gently. Hold catheter in the dominant hand. Steadily insert the catheter about 8 inches until urine is noted in the drainage bag or tubing. Advancing an indwelling catheter an additional 1/2 inch to 1 inch ensures placement within the bladder and facilitate inflation of the balloon without damaging the urethra. Do not force catheter through the urethra. Take a deep breath, sir. Ask the client to breathe deeply and rotate the catheter gently if slightly resistance is met. The sphincter relaxes and the catheter can enter the bladder easily when the client relaxes. Hold the catheter securely with your non-dominant hand while the bladder empties. Collect a specimen about 20 to 30 ml if required. Continue drainage according to hospital policy. Remove the catheter smoothly and slowly if straight catheter is used. Only needed to drain urine, not intended for continuous use. So, if a Foley catheter is used, introduce 5 cc. Gently pull the catheter until the retention balloon is snuggled against the bladder neck. Remove the fenestrated drape. Creates a balloon to ensure catheter retention. Maximize continuous bladder drainage. Proper attachment prevent trauma to the urethra and meatus from tension on the tubing. Attach catheter to urine bag below the level of the bladder. Tape catheter to the lower abdominal area to avoid reflux of urine to prevent infection. Remove and clean the equipment. Make client comfortable. Label the urine specimen and send to the laboratory promptly to avoid organisms to grow and distort laboratory findings. Wash hands to prevent the spread of microorganisms. Lastly, record the time of catheterization, the amount of urine removed, the description of the urine, the client's reaction to the procedure, and even other observations. A careful record is important. Reporting and recording of information about the procedure must be accurate and timely for continuity of care. Review client's health record and check client's chart for physician's order. Catheterization is only if with medical order. Identify the client and establish rapport. Hi ma'am, maayong buntag. Ako di si Maria, I'm a student for today. Pwede mo matala sa mga ma'am? Ensures the right client and elicits cooperation. Assess the need of client for catheterization. Explain the procedure to the client to elicit cooperation. Catheter sa imo ma'am para ma-eliminate ang urine sa imong body. Since maglisod man kag-urinate ma'am, di ba ma'am? So, okay ra ba na siya ma'am? Sige ma'am, thank you kayo ma'am. Provide good light to locate the meatus clearly. Gather the needed equipment. Organization promote efficient time management. Provide privacy by closing doors and windows because the client has the right to be protected from exposure. Replace top sheet with bath blanket. Place waterproof underpad under the client. This protect the bed linen from moisture and getting soiled. Place client in a dorsal recumbent position and drape client. Good visualization of the meatus is important. Embarrassment, chillness, and tension interferes with the introduction of the catheter. Wash hands to prevent the spread of microorganisms. And put on clean gloves. Do perineal care or flushing procedure. Remove and discard used working glove. Cleansing the perineal area prevents introduction of bacteria. It prevents the spread of microorganisms. Prepare the urine receptacle and tubing if an indwelling catheter is to be inserted. Tubing facilitate in connecting the catheter to the drainage system. Open catheterization pack and bring it near the perineal area. Observe aseptic technique to increase efficiency and prevent the spread of microorganisms. Squeeze a small amount of lubricant over the sterile OS placed in a sterile field. Organization promotes efficient time management. Now we will get 2 cotton balls and place them on a sterile field. And then we will pour some betadine. Organization promotes efficient time management. Put on sterile gloves to avoid cross-contamination. Grasp the upper corner of the fenestrated drape and unfold it without touching on sterile areas to provide sterile field and prevent contamination. Place fenestrated drape over the vulva area exposing the labia. Lubricate 1 to 2 inches of the catheter tip. Avoid clogging the lumen. To facilitate insertion of the catheter and reduces trauma to the tissues. With the thumb and forefinger of your non-dominant hand, spread the labia and identify the urinary meatus. Maintain the hold until the catheter has been inserted. With the dominant hand, disinfect the meatus twice using cotton balls with betadine. Cleanse the area and minimize the risk of urinary tract infection by removing surface pathogens. Insert the tip of the catheter into the dimple-like structures below the clitoris, which is the meatus, about 2 to 3 inches or until urine flows. Do not force the catheter through the urethra. Ask the client to breathe deeply and rotate the catheter gently if slight resistance is met. Take a deep breath, ma'am. The sphincter relaxes and the catheter can enter the bladder easily when the client relaxes. Hold the catheter securely with your non-dominant hand while the bladder empties. Collect a specimen if required. Continue drainage according to hospital policy. Remove the catheter smoothly and slowly if straight catheter is used. The catheter is only needed to drain urine present in the bladder and is not intended for continuous use. If a Foley catheter is used, introduce 5 cc of distilled water to secure the catheter. Gently pull the catheter until retention balloon is snuggled against the bladder neck. Remove the fenestrated drape. Creates a balloon to ensure catheter retention. Maximize continuous bladder drainage. Proper attachment prevents trauma to the urethra and meatus from tension on the tubing. Attach catheter to the urine bag below the level of the bladder. Tape catheter to the thigh. To avoid reflux of urine to prevent infection. Make client comfortable. Do aftercare of equipment. Remove gloves and do hand washing. It prevents the spread of microorganisms. Label the urine specimen and send to the laboratory promptly. Urine kept at room temperature may cause organism, if present, to grow and distort laboratory findings. Document the following: the date and time started and ended, the client's response and reaction to the procedure, and the client's output if required. A careful record is important. Reporting and recording of information about the procedure must be accurate and timely for continuity of care. Check the order on the client's chart. Removing of urinary catheter is only done if with medical order. Obtain a 5 to 10 ml syringe and an absorbent towel. Wash hands to prevent the spread of microorganisms. With the ticket, call out client's name, check the client's identification band, and explain the procedure. Inform the client that there may be a slight discomfort as the catheter is removed. Ensures the right client and illicit cooperation. Don gloves to avoid cross-contamination. Place the absorbent towel on the mattress under the catheter and attach the syringe to the balloon port. Withdraw all water or solution from the balloon. This protects the bed linen from moisture and getting soiled. Hold the absorbent towel in your non-dominant hand in front of the perineum. Pinch the catheter near the meatus with your dominant hand and pull it steadily out into the absorbent towel until the end is retrieved. Hold catheter at an upward angle to the drainage tubing so that urine in it will drain into the drainage bag. Inspect the catheter to make certain if it is intact, and if not, notify the physician immediately. Measure the output in the drainage bag. Record the output on the INO sheet. Empty the urine into the toilet bowl. and dispose the urine bag. Remove gloves, wash hands to prevent spread of microorganisms, and make client comfortable. Instruct the client to drink extra fluid and warn that there may be mild burning with the first few voiding. Remind the client of the expected voiding time.
Lastly, document the time of removal and the time by which the client should have the next voiding time.
A careful record is important. Reporting and recording of information about the procedure must be accurate and timely for continuity of care.
So that's it, the step-by-step procedure of urinary catheterization. Again, this is Remedios Cabañero, your student nurse signing off.